So with regards to the setting in which the fellowship training occurs, it is kind of unique, and it warrants saying something about briefly. So as a residential level of care and setting, most people picture something with a lot of constraints, locked doors, privileges, and coming to Riggs can be a jarring experience because it is an entirely open and voluntary setting. So our way of holding treatments, and especially complex treatments, where for many of our patients the question of whether they want to be alive or not is on the table. The thing that constitutes kind of our holding and our frame is our relationships and our agreement about a shared task of treatment. So when our patients come here and are admitted and to our setting and agree to engage in this work, what they're agreeing to is a way of bringing things, all of the things that are painful and maybe impossible to talk about, and in other settings might be discouraged or kind of pushed aside, and there's a lot of emphasis on safety planning and locks and things like that. Here, it's all about saying the difficult things and bringing in words the experience into the work, both in the analytic therapy, but also in the community. We have a therapeutic community program that patients are actively engaged in, where there are group offerings, opportunities for involvement and taking up agency and authority in members of patient government. And we all are part of that community setting, staff, patients, and engaged in that mutual and collaborative work. So when people come here and they imagine a residential setting with a lot of locks and distinctions between patients and staff and hierarchy and authority, it can feel kind of strange to walk into a building where we're not wearing name tags and things that distinguish us from one another, and rather we're all here and a part of this mutual effort.
And it's probably worth saying as well that within the residential setting, there's a continuum of care. So there's a main building which houses about half of the patients, the ones who are maybe more acute. But there are step downs with different learning foci, a step down program with a more independent living skills learning foci, another step down with a focus on group living, where there's a lot more daily meetings. There's a day treatment program, so patients can move away outside into the local community and are coming in for their treatment services. And there's an aftercare program where patients no longer have access to the therapeutic community, but are continuing their work. And that roughly approximates an outpatient practice. So again, you're having the range of experience in your work, from working intensely with people who are being held in a setting, which actually I think at times allows you to work at greater depth and to take risks with those patients because they're held, in terms of the things that you observe about them, that they're struggling to see themselves. But on the other end, you are also working with people who are essentially now working with you in what feels like almost like a private practice model. So you get a range of experiences within that.